think that there's two answers to that. The first is that our current therapeutics are quite effective at controlling sort of the bleeding process and the leaking process in the back of the eye for wet AMD. And we're fortunate to have them as physicians and as patients. But the long-term treatment burden is quite substantial for patients, and to receive shots in your eye repeatedly for many years, often indefinitely for these patients, is a huge burden. And there's a tremendous amount of data now showing that the consistency of appropriate treatment drops off over time. Such that after 3 years of treatment, probably less than half of patients are receiving adequate dosing to maintain optimal control in the real world. So while the treatments we have currently work, it's the burden of care that really limits their long-term utilization in the appropriate way that many patients need. And therefore, to have a treatment that is more durable, that is potentially, even in the situation of a gene therapy, one and done, is quite promising. And that's not easy to achieve, right? To achieve an intraocular biofactory that's producing a therapeutic indefinitely has been a very, I think, important goal to reach after, but it's been difficult. And we've learned a lot along the development pathway here, both from this program and from other programs trying to achieve the same endpoint. And so I think that there really is a need, and I think we would see improved outcomes in the real world if we had a gene therapy that was safe and effective at producing intraocular anti-VEGF production long term. Certainly, cost is relevant to medical care for many different reasons. And our current therapeutics are also expensive. So I think that figuring out what's going to achieve the best outcomes in the safest way for patients is my priority. When I have patients in front of me, I'm trying to get them the very best outcome in the safest way possible. And I think that cost is quite relevant, but something that we need to figure out over time.